Hello, hello, my beautiful people. Welcome back to my podcast, All Things Health, the podcast where we do all the research on all things health so that you don't have to. And we have fun while doing it. I'm your host, Mary Mitchell, and as you know, I like to dive in and just talk. So I've been trying to find out a few things of like what I can do, and I think I might start doing like a night routine because most of the time when I record my podcast, I do it at night. That way I have my makeup still and everything. I still look good. You might have a few podcasts though where I don't have my makeup. And actually, there's going to be a few little mini podcasts that are going to be coming out soon of me cooking. And I will be coming out with a cookbook soon that you guys can purchase. I don't know the pricing yet, but it is coming. So there's my little surprise announcement there. But as I have said, my name is Mary Mitchell. Today we are embarking on an adventure, and before anyone switches this off or switches off their mind thinking it's not for them because of what the title says, it is not true. So let me tell you, today's episode is not just for women. It is also essential for men as well, and all in between. Okay, it is if you have breasts, male or female, or whatever, if they're there, this is about you. Okay? Okay. Glad we have that understanding. Breast health is a concern for everyone, like I said. So let's gear up for our comprehensive look at those wonderful little buddies of ours. Okay? Breasts, they're not just, aesthetics. They're not just for feeding babies. They are complex structures, and they can also be indicators for your overall health. So let's just start with a basic understanding what makes up the breast, right? For women, breasts are composed of a glandular tissue, and that is for milk production. It also has fatty tissue, and that gives them the size and the shape. All breasts are different, and most women have at least one breast that is bigger than the other. And it also has all of it has connective tissue and it holds it all together. So just being all held together there. Men have breasts too, albeit with a bit of a significantly less glandular tissue, and that does mean yes, men can encounter some of the same issues that women encounter as well. All right, let's just pop over to kind of a man and woman side by side and what the like anatomy of their breasts are. While less common, conditions can happen in men as well, like I said. And there is one called gynecomastia, and that's where the male breast tissue swells up. And this can occur during a hormonal imbalance. And it also can happen while you're on certain medications or having health conditions as well. Moving on to some of the most common non-cancerous breast tissues, we have the fibrocystic breast changes, which is many women experiencing lumpy or tender breasts due to hormonal fluctuations. And it's not usually serious, but it can be, something that you might want to talk to your healthcare professional if you start to get worried about. And then you have your infections and your inflammations. There's an infection called mastitis. Most women who are breastfeeding, or sorry, let me rephrase that. It happens mostly to women who are breastfeeding, but on rare occurrences, it can happen to women who are not. And on even more rare occurrences, it can happen to men as well. Breast cancer is a major concern and it's affecting 1 in 8 women over their lifetimes. And while significantly more rare, it also affects men as well. Early detection is key and it makes a huge difference in the outcomes. So, let's all check out the signs that you might want to watch out for, shall we? Lumps and bumps. Not all lumps are cancerous, but any new lump or change in the breast, it should be checked by a healthcare professional. So if you're, all of a sudden, even if it's not painful, if it's something that's unusual for you, you might want to just get it checked out. And maybe it's nothing, but at least you got it checked, right? I do have a friend. I have a few friends who have had breast cancer or have still breast cancer. I have one friend who I've known since elementary school who just recently passed away from breast cancer. May she rest in peace. This episode is dedicated to her. Her name's Elizabeth Hart. And I have other friends who are fighting it now and one who is in remission. So congratulations to her, and may the battle stay strong for the rest of my friends who are fighting it as well, and who are fighting anything, really, doesn't matter what it is. May you stay strong. Let's get back into the characteristics of what to look for when you're feeling your breasts. So we have the lumps and bumps. We had visual changes, dimpling, puckering, or any changes in the skin over the breasts can be a definite red flag. So you really want to get to know your breasts. You want to get to know what they look like, what color the nipples usually are, the shape of everything. You just like become one with the breast. It is your body. You are one with it. It's your body. And it's very important that you do that. Just stand in the mirror and yeah, I know you guys look at yourselves naked. I mean, we all do. I look at myself naked, and some days I'm like, damn, girl, you're looking good. Other days I'm like, ugh, I need to put a towel on and go freaking put some clothes on. Sometimes I'm happy, sometimes I'm not. But anyways, so get to know your breasts. Another thing that you need to look for is any nipple concerns. So, like I said, get to know your nipples as well. Make sure there's no discharge coming out. Make sure the colors haven't changed, no retraction, not anything like that. Like they're not looking any different than they normally are. Okay. While we can't change some risk factors like genetics, there are lifestyle changes, that can reduce your risk. And of course, everyone's going to know what the first thing, or at least almost everyone's going to know what the first thing that I'm going to say. And that is diet and exercise. A good, healthy diet and a nice exercise regimen is 100% key to your overall health, as well as your breast health. And I'm one to talk because I have a trainer, but like it's really hard to do it. Ever since I've had my hysterectomy, it's been really hard to get back into that routine because I was out of working out for like 6 weeks, something like that. It was horrible and it sucked. And my trainer's fabulous, so she's doing everything she can to get me back on my feet. So wish me luck. But for you as well, diet and exercise, limiting your alcohol intake. So like reduce your alcohol consumption. Reducing your consumption is the link to lowering your risk to that kind of stuff, like breast health, and quitting smoking. Smoking is definitely limited to not just breast cancer, lung cancer, any type of cancer, really. Many types of cancer is linked to smoking. So if you're concerned about breast health as well, like maybe family members have had it or things like that, there are several diagnostic tools at your disposal, of course, depending on your insurance and where you live and all of that fun, amazing stuff. But you can get a mammogram, and that's where you stick your breast into the machine and it looks like this, and you put your breast into it and it closes on it and just makes it like that. And it's really uncomfortable and it's really awkward. And sometimes you have to put your hand up like this. And I had to. I had to have one because was concerned about a lump. And I had dense breast tissue, and that's can be a risk factor in breast cancer, like having possibly getting breast cancer. So I have to get one every 1 to 2 years now. Yeah, mammograms are not fun. The main screening tool for breast cancer is mammograms, though. And it is at your annual breast checkup after about age 40. That can be different depending on insurances and where you live again, but about 40 years old. You also have ultrasounds and MRIs, and usually they do that after you've either after you've had a mammogram and it didn't work, or they need to get a closer look, or maybe because you're too young, like if you're under 40 and they're just really not wanting to give you a mammogram yet. I was denied one when I was 28. Um, then you can possibly get an ultrasound or an MRI. And then you also have your biopsies, which is not something that they do like all the time. It's definitely something that they have to do if after they've like seeing it in imaging and stuff like that as well. Then they'll cut you open, they'll take a biopsy, send off for labs, and then from there you'll meet with your doctor and then they'll figure it out. If there's an unfortunate thing happening and you do end up being positive for cancer, there are Options that vary depending on the type of cancer and the stage of cancer, but they can include surgery. You can have a lumpectomy or you can have a mastectomy. And mastectomy, or I think is how you say it actually. The mastectomy is where they basically take partial or full breast. And then a lumpectomy is where they remove lumps or tumors, things like that from your breast. And then they also have radiation therapy, which is it's to target and kill your cancer cells. And then they also have chemotherapy, which is often used when cancer is more widespread and not just localized. And then they also have hormone therapy for cancers that are more hormone and receptor positive. So knowledge is power, you guys. Like knowing these kinds of things is really, I dropped my ring. Knowing these kinds of things is really important because the more you know, it's like that rainbow. For those of you who are about my age, you know, reading rainbow, like reading rainbow. So like knowledge, man, know your stuff. Knowledge is power. Power. Raw. Understanding your body can lead to earlier detection of issues and greater chances of successful treatment. Like if there is something that's found, knowing that they detected it sooner can give you a better chance of possible recovery from it. So we encourage everyone to learn the normal look and feel of your breasts, report any changes to your healthcare provider, make sure that you just know your body and not just your breast, like your entire body, get to know it. And I know this sounds weird for some women, maybe even men too, like if you need to look between it and stuff, but get a hand mirror and get to know your vagina too. Because if things start to look different or feel weird, you'll know what your vagina looks like. And you'll know what your butt looks like, and you know what your penis and your balls and all that stuff looks like. And that way, if there's any changes, you can report that. Just an idea. Don't come at me. Just trying to help. And remember that there are fantastic resources out there. There is the organization National Breast Cancer Foundation. I will put a link at the end of the page as well as when I post it'll be in the description, but I'll put it also on the like a picture at the end. But it's called National Breast Cancer Foundation, and they offer guides, support, and tools to help manage your breast health. I am gonna real quick put a picture up, and that's gonna be for a self breast exam. And that's how it's gonna kind of just show you how to do a breast exam. So go ahead and take a look at that real quick, screenshot it, do whatever you can to save it. We've covered a lot today. You know, this is just the tip of the iceberg. Breast health is very important as well as the health of the rest of your body, of course. You know, it's a topic that deserves a lot of attention and respect because a lot of times men don't even realize that it's very important that they also take care of their overall health and make sure that their breasts are not going to, change or look any different as well. So take it serious, men. Serious. Okay, take care of yourselves. Thank you for joining us today for this deep dive into breast awareness. Keep those bosoms beautiful and healthy. And, remember to take care of yourselves. Keep laughing. Tune in next time for more insights into your health. And stay healthy, stay happy. I love you guys. Don't forget to subscribe, like, share, comment, do everything you can to get me out there. I love you all. I'm getting a new camera soon, so hopefully the quality will get better. And I'm thinking of trying to do like a different background. So let me know what you think. What kind of backgrounds do you like? Have a great week, you guys. Happy Monday.